welcome to IFA's Global Cafe. My name is Gregor Snedden. I'm the Secretary General here at the IFA, and it's my pleasure and privilege to host today's session. Before we begin, just to briefly go through a couple of housekeeping matters, please be advised that this session is being recorded. It will be posted later on other social media channels, and I believe it's actually live on LinkedIn. We encourage you all to participate. So if you have any comments or questions, please make sure to pose them using the chat function. And also, please be aware of your microphone and kindly keep it muted unless we invite you directly to ask your question. This helps minimize background noise and ensures we can all hear the speaker clearly. Now, to start today's session on aging and artificial intelligence, it's my great privilege, and I'm so excited to introduce our guest, Miss Shainoor Khoja. Miss Shainoor Khoja is a trained professional in physical therapy and health technology, the founder of Thriving.ai. After years of caring for parents and in-laws from a distance while navigating a fragmented health and social care system, an experience shaped by a pivotal moment when she found her mother alone on the floor in her apartment after hours of being alone. And her career spans decades across 4 continents, which she has built and led ventures in healthcare, telecommunications, social innovation, and working closely with civil society, governments, and global institutions. And these experiences, from scaling healthcare services to designing technology-enabled solutions for underserved populations, inspired Thriving.ai, a digital health platform designed to shift care from reactive to proactive and support aging adults, families, caregivers in living healthier and more independent lives. Recognized globally for her contributions to social impact and innovation, Ms. Khoja remains focused on ensuring aging is a dignified, equitable, and fulfilling experience grounded in community-based care and the thoughtful use of technology. So without further ado, welcome.
Thank you very much, Gregor, for having me, and thank you for all those that are listening and going to contribute to this conversation.
Thank you, Shane. And we've had the chance to be together on a couple of occasions, and gosh, it always just feels like we just get the conversation started. And so we have a little bit of limited time today, of course, but you have such a varied background, and you can weave so many stories from all your experiences. Your transition from hands-on caregiving to co-founding Thriving.ai really stemmed from these deeply personal experiences. How does that lived perspective shape your thinking or your philosophy for integrating AI into aging care beyond just, technology for its own sake?
No, thanks, Gregor. And you've mentioned that, I had a decade of physioing, so I saw a professional lens of the fragmented and siloed care systems and how people fell through the cracks because we didn't have an integrated net. And then sadly, I had the opportunity to see it from a caregiver's perspective and lens, and I'm qualified and knew how to navigate these fragmented systems. But as I looked at it, it drew a parallel to me for what I did in Afghanistan, because when you look at a poor person that you're trying to get on their feet, they don't just need a job. They don't just need financial inclusion. They don't just need clean water and housing. They need it all.
Yeah, right.
So similarly, when you think about aging, they need it all. And so as I looked at technology, I realized that actually we can use technology cleverly to connect the dots and take away the data capture, the sort of analysis and so forth, and actually create an interconnected system that provides more time for that human connection, which we all know from research is the number one sort of constituent to a healthy, independent life. So that was kind of the genesis of it, and drawing from my experiences all round to understand how best to place the technology. That doesn't mean technology gets adopted, but that was the
Yeah.
basic, the foundational piece of it. Yeah.
Well, maybe it would be worth just, why don't you just give us a picture of thriving.ai. Like what is it? Just give us the kind of for all of our listeners. I've had the fortunate of having you share it with me and present to me. But what tell us about it. What is it exactly, and how does it work? And how does it create the opportunity for more person-centered engagement and care? People are often wondering, oh, is AI and technology just taking away our jobs and so on and so forth? But that's clearly not the case with
Yeah.
Thriving.ai. So tell us about it. Yeah.
So perfect. So basically, Thriving.ai was built with older adults for older adults. And that was the first thing, right? The stereotypical view that older adults can't use technology. Not true. If you do the research, 75% of 75-year-olds and above are using technology today. It's just most of the technology has not been designed for them, by them, but has been designed for mass market, and then during COVID and that was just repositioned and repurposed for older persons' use. What Thriving AI does is actually it puts the person, we call them the thriver, at the center, and it surrounds them with a circle of care, a virtual circle of care of loved ones, professionals, informal carers, whoever's involved in everyday life. And then within that circle, it provides them the opportunity to capture and share data, everything from mental health to sleep, to exercise, to nutrition, to resources, so that this data is available in near real time to the thriver, the individual using it, and also those people they choose to share it with. Why is this important? Because when you have access to this data, what we are able to do is actually give you intelligent nudges to change your behavior so that we promote positive behaviors and reduce the risk of a crisis. No crisis just happens. Very few of them just happen. There's a series of things that go wrong that eventually result in a crisis. And if you can look at the trends, and if you can pick up those issues that you need to deal with early, then actually you can mitigate the risk and improve quality of life. So that's really where thriving sits.
So it really is moving from being just reactive to being proactive. It's a much more holistic kind of model and tool that maybe share some examples. Where does AI or thriving AI, how does it enable earlier interventions or predictions that maybe are even impossible in traditional care models?
Sure. So let's go back to health and wellness, right? 20% of our health and wellness is as a result of our diabetes, our blood pressure, our heart rate, and all those things, right? 80% of it is as a result of the social determinants of health. These are how
Mhm.
we eat, how we sleep, how much we exercise, what our mental health is, etc. And therefore, what we do is we focus on these areas, right? And so let's take an example. Let's say you haven't slept well, your mood has deteriorated over several days, you're visiting the washroom in the middle of the night a lot, and perhaps your walking and gait has been affected and you're losing a little bit of balance. Now, these could be symptoms of anything, but they could be symptoms of a urinary tract infection, for example, which, if left unnoticed, can lead to things like a fall. And so, if you can set up an alert that just says, drink a bit more, perhaps exercise some of these mindfulness techniques so you sleep better and you inform a loved one that has a conversation, then you deal with it without antibiotics, without the fall, without the emergency call out. And this is what the sort of trajectory that we are taking.
Mm.
Another example, if I may, Gregor, very simple, is one of the things that we have within the application is a check-in function, right? You just check in and say, hey, I'm fine. We ask you how you're feeling that day. It's a red, amber, green. And depending on how you respond, either an AI companion will talk to you or you'll get a inspirational quote. Now, what that means is that I already know that my mother is alive and well. I already know how she's feeling. So now my conversation, rather than being an interrogation, Mum, did you take your pills? Mum, how are you feeling? Mum, you
Mm,
know, it's a question of what was your inspirational quote today? I thought that was really nice. And it leads to deeper, meaningful
mm.
conversations, right? Away from the day-to-day data capture that's required and
Right.
important.
You're just being able to, as you just mentioned, you're addressing much more directly the social determinants of health. You don't need to spend your time doing a doctor check-in. You can just call to ask, how's her painting project going? Because you already have the answers to the other things. Yeah.
Exactly. And I'm not minimizing a doctor's or a medical approach at all.
Yeah, of course.
I think both are important, but I
Uh,
think we place too much emphasis on the physical metrics and all the research. I think most people will know about the blue zones. They'll know about the Harvard 75-year-old study on health and wellness. And the number one thing is around social connectedness, right? And I have an example of this on my own hands. So, my mother's situation turned up that, she has become full-time dependent on me with two caregivers, and her physical condition has deteriorated, but she still lives a very fulfilling life because she has a social environment all around her. And if
yeah.
you look at some of the stats after a fall, if you're institutionalized, it's 1 to 3 years. So, there is a lot of data that's supporting this. And I think it's time we paid a bit of attention to it.
Well, a couple, gosh, lots of different questions here. I mean, we've talked about, predictive analytics to the remote monitoring. So how do you balance the technical promise with the ethical, to preserve autonomy, privacy, and dignity for older adults? Like, how do you balance these? Because you can move so technology is always moving faster than we can keep up. So how are you keeping the reins on the horse team here?
So I think voice and choice are very, very important here. So when we started off and we were building with older adults, everyone said, we don't want wearables. We don't want a pendant. We don't want a watch. We don't want you watching us with a camera. So we went with ambient sensors, right? These are smart plugs, bulbs, movement sensors, contact sensors that gave us a sense of where you are, what you're doing, and all anonymized, encrypted, right? Then, when we went into looking at things like Alzheimer dementia patients, early onset, it was a family situation because this can come up when you're in your 40s, right? So then we needed to associate movement with a particular individual, differentiated from other people in the household. So there was no way around not having a wearable. But again, it was a choice. It was a trade-off against, do I wear the wearable and keep my independence? And this is how the data will be used, or do I not? So I think voice and choice is really important. And even today in the app, you can choose to or not choose to and use it in different ways. But I think that the other part of this question is all around regulation, licensing, protection, and exploitation. And that is non-negotiable for older persons or for anyone. And so there is a lot of regulation around what you can and cannot do, where you store the data, how you store it, how protected it is. And we comply with all of these things.
Mm,
Um, when I'm the innovator, I sometimes complain because I say, there's so much regulation, it's stifling innovation at times. But I see the importance of it. And I think that's the challenge for policymakers, for governments to kind of manage that fine line so that we don't stifle innovation, because a lot of innovation comes from the grassroots up. And those grassroots organizations don't always have the financial resources to sort of keep up with regulation.
Well, and we still we don't have global frameworks. I mean, they're all still at country level, some regional. Europe has one, for example, but there isn't a consistent a tool or barrier or global policy structure around privacy and protection with emerging AI, which is something we need to work towards while balancing the opportunities for innovation, but also protecting the individual. So important. Bias in AI is another huge concern. The way that algorithms are developed and managed, and older adults are highly diverse in health, culture, and technology use, even within a single region, let alone and from a global perspective. So how is driving AI approaching inclusivity in data and design to avoid reinforcing inequalities or unhelpful biases in the way that it's using artificial intelligence?
The short answer is with difficulty, but I'll go into that a bit more detail. So, bias is a huge issue, and for many reasons. It's the first time that our world is getting old. So, for a start, there's very little data around aging and older adults. And that data that exists is obviously dominated by the demographics of the West.
Hmm.
And those demographics aren't representative of the global world that we live in. So, the way that we're working on this is that we are piloting and working in areas where cultures are more diverse so that we can capture that diversity in the data. Additionally, any pilots we do, we try and ensure that there is at least a 30% diversity pool within that cohort. And then beyond that, we're also working with specific groups, cultural groups, so that we can look at the data and look at the disparities. And I'm not the expert on this, but our data scientist is working on machine learning and AI techniques that allow us to simulate patterns in the data so that we can make the data less biased when we are generating synthetic data. And so I don't know that we have the full answer, Gregor. I'll be honest with that and
Mm-mm-mm.
upfront. But we are not blind to it, and we're trying to accommodate as much representation as we possibly can.
Yeah, it's not easy because AI is by almost de facto it is about algorithms and it's managing repetition and systems and movement. So it's I think everyone is facing that across the spectrum, not just in health and aging. It's just by the very nature of how AI works itself. You talked a little bit before about, I think you said 75% of people over the age of 75 are using technology, but it's just not designed for them. So, user adoption, especially of new technologies, can often be a barrier, and often by older adults who feel maybe intimidated by using new technology and so on. How do you address digital literacy, say, and accessibility so that the platform is generally empowering and not alienating?
Sure. So again, we've learned a lot by just going through the process. So we started off with this sort of we know it all look, and we produced an Invisio, which is sort of a demo model of an application, and we took it to 10 older people and their family caregivers, and 10 out of 10 kicked us out the door. And they said, look, really happy that you're trying to build with us, but we're not stupid. We don't need just one button in the middle of the screen to press. We want something lively, vibrant, colorful, but we need you to take note of the fact that it needs to be simple, it needs to be the right colors, the right font size, etc., incorporate voice. And so we've learned from user feedback. And we're at a place where the platform is simple, it is intuitive, it can change font size. We have incorporated voice where we can, but this is, and also guides, bots that help you through to remember what certain things do. But this is an iterative process. It's not a start and done and we're done.
Yeah, yeah, yeah.
Each deployment, each interaction teaches us more. And that's why, when you said adoption can be an issue, like 79 to 94-year-olds, we have 90% adoption.
Wow.
But when you talk about adoption in mainstream healthcare delivery, that requires a collaborative approach. It requires progressive stakeholders to work together to get to the end goal. And that is difficult because healthcare itself and social care, because they're dealing with vulnerable populations, evidence is right up there. They need, large scale evidence to deploy large scale. And it's a bit of a chicken and egg because to
Mm,
get that large scale deployment, you need a progressive partner. And to this end, we work with key opinion leaders, we work with universities in Canada, we work with SAM3 and Carleton University, with the Vector Institute, which is an AI institute. We work with government organizations like Envisage and AgeWell, IRAP, that help us in this process. And equally, in the UK, we're working in Manchester, which is an age-friendly society. We worked with the Turing Institute and Manchester University. All of this really to give us the credibility to reach out to care providers who know that if we're working with these types of institutions, that we are covering the basis in terms of care, protection, quality, etc.
mm.
And so that's really how we're addressing that piece of it. When you look at the economics of it, Gregor, it's very simple because of our time working in places like Afghanistan and Syria and Pakistan and so forth. Thriving AI has been built on quality, affordability, and accessibility.
Mm.
So if you do a simple equation, right, and maybe I will take the example of the UK because it's coming quickly to me, but an ambulance call out is somewhere around £270. A accident and emergency consultation is another £700. So now we're at 900 and something pounds. And invariably, there's a 1 night or 2 night hospital stay, which is another 500 a night, right? So when you add that up and you add up the cost of the platform for a healthcare system, which is hugely subsidized, basically, on a 50,000 population, you only need to save 10 or 12 visits to have paid for the platform.
Mm.
So the economics are there. It's the evidence that's a little lacking. And
Right, the chicken and the egg, yeah. Well, this leads me to, this while we were I was just at great experience with our friends at the Hong Kong Council for Social Services in Hong Kong at their Tech Expo, Jaron Technology Expo this past well, a couple of months ago. That's where we're hosting our 2027 Global Conference on Aging with them. And, it's just incredible that, AI and Jaron Technology are making these incredible strides faster than we can keep up with. And also our policy frameworks, our equitable policy frameworks. So like a country like China who's racing towards a population of 50% of people older the age of 65, they're driving their technology development at a remarkable pace there in the Bay Area,
Mhm.
around Hong Kong. And China, though has a strong tech infrastructure and to deploy and engage sophisticated technology. And oftentimes this technology, Geron technology, it stays in laboratories or stays in the ivory tower. It's just far too expensive to scale. And what about regions or lower resourced countries, low and middle income countries, where there isn't even the infrastructure, like if you think about a rural area, nor the resources to support high powered or complex tech? What's needed to deploy and scale technology solutions in these regions? And what kind of technology might be used that may not be as constrained in low capacity environments? Does that make sense, Mike, what I'm asking?
No, it makes total sense. I think last mile digital connection should be a human right, and that's what we believe in. So, in certain parts of the world, a sister company of ours is actually delivering that last mile connectivity because today the mobile phone has become your doctor, your lawyer, your bank, your educator, and whatever else, right? And we've seen technologies leapfrog the West, as we did in Afghanistan. We built telemedicine in 2006, 7, separated co-joined twins in 2008 and 9. And when COVID happened and everyone was sort of excited in the West about telemedicine, we were like, where's the world been? This should have been around a long time ago, right? So, but to answer your question, today there are technologies available. So, for example, if we take the example of Afghanistan, Tajikistan, or even Rwanda, where there are community health workers that go out to rural populations and provide them with care. Today, there's technology available to actually capture that data in place, right? So you go out rurally, you go out with your device, you can capture that data, you just can't transmit it from there. So there's a bit of delay because you've got to bring that data back to your hub or your central point in town or the city to then upload that data and manipulate it and use it. So there are solutions that are bypassing the need for actual real-time connectivity, and the trade-off is that you get delayed data, but you don't exclude people from participating.
Hmm.
What is really interesting, though, and something that we are working very hard to evidence out and demonstrate, is that actually, if you can bring last mile data connectivity with applications that can help people in those rural communities, whether they be access to finance, access to farming, access to healthcare, then that becomes valuable and they become able to afford the low cost data that you're providing.
Hmm.
And this is precisely the kind of model that we're using in rural parts for Rwanda, for Kenya, Ethiopia, Afghanistan, etc.
Hmm. Excellent. Well, there's love to gosh, explore that economic case, to be able to also attract investment because there's clearly a partnership model there that could private sector and civil society governments that could and the end user, of course, and those communities can all benefit together by being a little bit, I think, more forward thinking. Oftentimes the deployment of technology is the bottleneck is the upfront cost, and we just can't see beyond that upfront cost. But the benefits are huge, as you just narrated. Like
And
looking
I think,
ahead,
sorry, just
no,
to
go on,
that
yeah.
point, I just wanted to give you an example. When we brought M-Pesa, spelled Paisa, to Afghanistan, the platform cost was $3 million, which was prohibitive. But there was millions of Afghans that kept $1 and $2 under their mattress. And the minute you got them banked, the overnight interest began to pay for the platform. And I think this is the kind of thinking, right?
Mm,
I've just sort of demonstrated that, if you can cost save a certain number of hospitalizations and emergency callouts, you can pay for a platform like Thriving. And therefore, it needs that progressive and collaborative stakeholder group to push it forward. Because once you can prove that, then you can actually begin to scale. And let's really look at this from an economic point of view.
mm.
We're going to be 2.1 billion people over the age of 65 by 2050, right? That's another 15, 20 years. We cannot hospitalize or institutionalize all those people. It's
Yeah,
just
yeah,
unsustainable.
yeah,
And
yeah.
so rather than get to a crisis point, and I think places like China and that are going to sort of prove this out first. And I think also emerging markets that leapfrog are probably going to prove this out before perhaps the West catches up.
Yes, I think you're right. Well, listen, we have a lot of questions here coming through
Okay.
in our chat, and we're always so fortunate to have people with us from all over the world. So let's see if we can ask a couple here. We have a question from Linda Amakor from Nigeria. She's a wellness-led interior design and lighting specialist focused on aging in place designs. Oh, sorry, that wasn't her question. It was actually Isaac Carrasco Ortiz. He asks, where does the data come from that goes into determinations about a person's health state? So where does the data come from? Maybe show us
Yes.
the flow, the channel.
Yeah, excellent. So on the Thriving app, there is inputted data that is your interactions with the application. So, for example, your mental health, how you're feeling, etc. But then we have the ability to integrate these smart sensors, which are plugs, movement, contact sensors. That gives us data around your movements in an environment and also data from, for example, a flush, a bathroom, a kitchen sink, and the water utilization and so forth. So that's data that we pull in. Then, if you wear a wearable, we can pull data from there around sleep, exercise steps, and the rest of that. And then what we have integrated in the application is something called PPG technology, which is camera technology that actually scans your face for 90 seconds. And it uses the blood circulation and its reflection to give you your heart rate, your blood pressure, your oxygenation, your stress level, and your HA1C. So we put all of this together. Now, all of this data is 92 to 95% accurate. So we're not talking about using the solution for an intensive care type of remote monitoring. We're talking about health and wellness, right? And so we put this data together into an algorithm that gives you a weekly and a 30-day report that tells you how you're doing. And then what we do is we look at any trends in this, and throughout the day, there are sort of generic nudges that come to you that say, Gregor, drink a bit more, water is important for this reason. Gregor, move a bit more. Movement is important for this reason. And those nudges over time, as we learn about you, become more targeted. So if you have drunk, and right now we're working on a hydration sensor because that's a barrier at the moment with older adults. But we should be able to come back to you and say, congratulations, Gregor, your hydration level's really good, right? So that's the piece that we're still working on. But that's how the data comes in.
Really, really, and you can also do it on your own. You can
Yeah.
one of the apps that I got had the chance to give it give it a go, and I held the camera up as you remember there, and it did an assessment. Now, and you qualified that assessment that you would still need to see a doctor
Yeah.
and so on, but it was amazing what it told me, and you told me to
Yeah.
go get some water immediately.
Exactly. And I think the thing is that this is not about worrying older persons. It's about giving them the confidence to live independently, right? To move away from that fear of aging, fear of incapacity, to a more proactive set of actions and empowerment to access that, right? And that's important for older persons. It's important for people living rurally, right? Because for them, they might pick up on an issue, but they'll ignore it because the bus ride's too expensive, or they can't
Right.
get half a day off work, or if they go to the
Mm.
hospital, it's going to cost them so much. And they become a burden on their families. So they ignore it, and then it's a crisis.
Mm.
And then it's a hospitalization that's going to be $300 or $3,000, right? Which is unaffordable for them.
Yeah. Yeah.
And so by being able to do this kind of drip feed, if you like, it's moving people towards quality of life rather than sort of quantity of life and moving them towards a preventative model. And that's good for the system all round, right? Because right now our systems are failing
Mm.
and are struggling with burnout and sort of corridor
Yeah.
treatment because all these preventative things are ending up at the hospital door because that's the last resort. Um,
Yeah, I
and
think it's
so,
so true. It's really focusing on prevention, and it's also again addressing the social determinants of health. Because if somebody is engaging in their health earlier, there's relationship forming, which is just so important. It's not just seeing a health professional in the crisis or engaging in a crisis. There's an opportunity to build trust and engagement and even community through a process of engaging with your health. Not this. Let me go back to Linda's question here because she does actually ask a question in the chat. She says, "Do you think older adults might have an unhealthy dependence on AI that's treating it as a real person, which can lead to emotional manipulation, especially in aging in place homes where we have a sole occupant?"
I think that that's a very valid and real question. And I think that there is a high risk of that. One of the things that we do is we have what are called guardrails. So, guardrails are the ability to limit use cases where the interpretation can be negative, right? For a descriptive word. So let me try and simply explain that. So an elderly person might just say, tell me about Apple, right? Now the AI may not know that this person is asking about a green apple, a red apple, a golden delicious apple, or an Apple device.
Mm.
And the older person may not know how to prompt that. So that's a very simplified example. But guardrails are put in place so that certain questions cannot be asked. And in Thriving, we have implemented that, which means that we can't address every issue, but it's also protective to the individual. And that is the trade-off, if you like.
Fair enough.
But it is a very important question. And I think it sort of leads me to that arena as well that, you know, what gives me caution is too much tech, right? And all these stereotypical views that you've mentioned that, tech's going to take away our jobs and tech is going to replace doctors and surgery and all the rest of it. So I think I can see a place for tech where tech is helping in the background to create
Mm,
more space for the professionals and to create more space for family and community. I do not see a day, I hope, that a robot is giving an older person aid with their daily activities of living, such as actual care and grooming and so forth, because I think there is so much in that human connection and touch that is
mm.
important. Yeah.
Wow.
That
Yeah. Beautiful.
we,
Yeah.
we have possibly diminished that because we diminished that role, which is
Yeah.
a very important role. And much science exists in that connection arena, which is both touch, listening, and feeling that, no amount of tech can give you.
Yeah, yeah. Oh, fair enough.
Yeah.
Our friend Eli Mogobo from Rwanda is with us. Eli, I don't know if you'd like to just come off mute and ask your question if you're able. He may not. He may have. I'm not sure, but I'll just go ahead and ask your question. His question. He says, "Would AI have? Could it create
Yeah,
barriers for?" Oh, go ahead, Eli. Ellie.
yeah. Thank you, Greg, and Shane. I'm happy to be with you today. So my
Thank
question was: normally in our community, the physical interaction is very key between older people and younger generation. So my concern is to ask if there is no concern about uh, creating barriers between younger generation and the older people by using AI. So that is where I have a concern, and I thank Shens for this presentation, and I thank her because she has started something in Rwanda, and we hope to keep in touch. Thank you.
Thank you, Ellie.
thank you, Ellie. That's important. And the idea of the circle of care is that the younger generation and family can interact with the older adult and interact with the same resources. So I'm going to answer this in several ways. One is that when we've done our pilots with older adults, caregivers, whether they be informal or formal professional caregivers, have said, gosh, we feel loneliness and isolation. We're stressed about our own health and wellness, and we need opportunities to air and socialize the stress because we can't express it like child caregiving in a work environment. And so within the app, we have caregiver resources that allow them to sort of do a questionnaire, which is the Zareth Burden questionnaire, that helps them manage their stress levels and then access resources that are sort of mindfulness, meditation, etc. We also have within the app AI that picks your location and actually finds you activities to do in your community, which are intergenerational. They might be walking clubs, book clubs, cooking clubs, or whatever of that nature. So we stimulate that intergenerational and community connection so that there isn't this barrier that's developing. And one of the things that we did during COVID was we did Let's Thrive events, physical events where we brought older adults and younger adults together, and we color coded them with post-it stamps to sort of put their name on so we knew their ages. And we randomly connected an older adult and a younger adult to have a conversation about one of the topics we had on the board. for a 15-minute conversation. And these were people that had never met each other. What we found was for 7 minutes, they introduced themselves and talked about the topic. And the other 8 minutes, they talked about what was top of mind and worrying them. Very deep conversations. So we actually built this functionality in the app, but we've not released it just because we need to release it with reputable and recognized institutions that have volunteers working with them for the same reason that we are worried about any exploitation. Because if I got friendly with you, Gregor, and then on our fourth conversation, I said, gosh, I can't make rent this month, and you opened your wallet and you gave me $500, that becomes an issue for us.
Yeah.
So we see ways of counteracting these issues, and I'm not minimizing them, but we also have to look at the solutions from a risk-reward perspective.
Yeah, that's excellent. Shmuel has a question, and also Sarah Farewell about connections to government. And so the way Sarah frames it is what specific pieces of data would governments need to see to endorse technology uptake and adoption, which I think is kind of where Shmuel's coming from as well. Like, what do they really need to see to really move policy and move governments to invest in and adopt this technology? Because it just seems so clear. I mean, the return on investment seems so obvious.
Yeah.
What do we need to do?
So I think it comes down to evidence, right? Evidence and risk. And so what we are doing at Thriving is we're taking a population level cost model and we're discounting it. So what we're saying to governments is that, doing this for 50,000 or 100,000 people would cost you X. We will only charge you 50% of that for the first year. So we will take the risk with you. Let's try it on a small group. Let's look at the results. If we give you your ROI, next year, you know what it's going to cost you. We're not going to triple it. And it's sort of building trust and building that evidence with them, I believe. I don't know that I have the full answer, Gregor. This is the work that we're doing at the moment, but this is how I see it. And then I see allies like Help Age International, Help Age Canada, Age UK that we work with, and various carers organizations like the African Caribbean Care Group in Manchester. We work with them so that slowly through the not-for-profit arena that has a voice and advocacy, governments that sort of have filters up, and also through the communications networks like the GSMA and so forth, uh, in a way that we can sort of coalesce this information at the right forums so that somebody progressive there says, okay, let's pick this up.
Okay. We're getting close to our time here, but I want to try to squeeze in a couple more. Brandon Krigowski asks, he's trying to get clear on what the actual function of Thriving AI is. Is it supposed to act as an AI doctor, nurse, nutritionist, dietitian, or is it solely to harvest data from people and then sell that data to a bidder and hope that it's used for good healthcare related cause? Maybe.
No, great question. We don't sell data. We're not in the business of selling data, and we are not a medical device, which is what we would have to be if we were going to be a doctor or a nurse. What we do is we provide qualified healthcare professionals the data that they need and connect them to and around the individual and those that care for them so that we create that safety net ahead of a crisis, right? So if you're the physio, if you're the social worker, if you're the physician practitioner, if you're the daughter or the son, you're connected around your mother or father to each other so that you're getting real-time data that you can act on. We don't act on that data, and we don't ever say your blood pressure is high. We send you that information, and then you consult with your doctor, or your daughter will look at that and say, hey, mum, I've noticed that your blood pressure is coming up high quite a bit. Let's book an appointment with the practitioner to get an overhaul, right? So that's where we're basically the data connection pipe, right? We're bringing the right data at the right time to the right people to make the decisions. We don't make the decisions. Can we make the decisions? Probably we can, but it's not something that we feel is appropriate at this point in time.
Well, listen, Shane, this has been just a remarkable, hopefully a first conversation of many. There's just, it's such an exciting area, and your work is so inspiring. And as we continue to work together with our other colleagues into the future, I'm sure we'll have other opportunities for further engagement. Um, I'm just going to ask you one more question here while I wrap things up, and then I'll bring it back to you for the last word, something you can think about. As AI evolves at breakneck speed, including agentic systems and deep learning tools, what excites you most about the future for technology and aging, and what gives you pause? So what gives you hope and excitement, and what gives you pause? So maybe just think about that for a minute as I wrap us up. I'd like to thank all of our guests who have joined us from around the world today. Our next topic at the Global Cafe will be advancing hearing, vision, and brain health for healthy aging, which will be on March 12th. So we look forward to seeing you same place, same time at then. It's been a real pleasure to have you with us today, Shane, and a great experience. So back to you for the final question. What gives you hope, and what gives you a pause?
I am super excited because I think this is going to impact all of us, because hopefully we'll all win the lottery to get old, right? And most people will live 90, 100, 110. So what gives me hope is the ability to use this data and this mechanism to actually get to a place where we can avoid suffering. We can mitigate risk before suffering, disruption, and pain, where we can take away the fear of aging and make it a much more positive, engaging and involved experience, and giving greater independence and quality of life. I think all of those things we all aspire to, and that's what this excites me for, because it democratizes access, right? From the poorest to the wealthiest. And I think that is really important. I think what gives me a little bit of caution is too much tech. And I've said this earlier, right? What we don't want is the efficiencies to take over and supersede empathetic care, right? We want to make sure that we maintain, nurture, and support the human touch, which is so important, because otherwise the pendulum's going to swing towards tech, and then it's going to have to swing back because there'll be negative consequences. I don't think any of us should uh, live where our whole life is managed by tech, right? Tech is there to enable, not to replace. And I think that's what gives me caution.
Well, yeah, tech is there to enable, not to replace. It's about the human person, and human touch and connection is how we'll live together and thrive into the future. So thanks again, Shane. Just a real pleasure to have you with us, and all the best with Thriving.ai and your family, and we'll see you
Thank
soon.
you very much. Thank you.
Thank you
Speak soon.
all.